Self-management of asthma and how it can be improved. What is asthma? Asthma is a chronic respiratory disease that causes your airways to become inflamed. Asthma causes inflammation or swelling in the lungs. It can also cause squeezing. This is called bronchoconstriction, and also extra sensitivity or twitchiness in the airways. When inflamed, our airways make extra or more mucus, which makes it harder to breathe and causes this coughing and wheezing, the classic symptoms of an asthmatic. What causes asthma? There are three main inducers of asthma, and these are exercise-induced asthma, allergy-induced asthma, and occupational-induced asthma. Exercise and allergy-induced asthma are pretty self-explanatory. Exercise-induced means it comes on with exercise. Allergy-induced means it's triggered by substances such as pollen or mold. But occupational asthma can be triggered by workplace irritants like chemicals, fumes, so working as a mechanic or working in somewhere like a factory where there's a lot of smoke. These can all cause asthma. Self-management of asthma. The two most common self-management strategies of asthma sufferers are inhalers and action plans. So action plans allow sufferers to have a step-by-step plan on how to manage their asthma. So it's starting from when an asthmatic is well, just having an everyday asthma under controlled, if you need something, take your reliever moment, to the point where you are very unwell, almost at the stage of an asthma attack. So the action plan lets others see what medication the asthmatic is using to relieve their asthma and what to do in certain situations. So it shows in the picture here, the green is when well, asthma is under controlled, almost no to little symptoms. Then it goes on to when not well, asthma is getting worse, worsening situation, and in all of them it states what reliever to take, what preventer to take, and how much of each one, and you can put any other instructions. And if symptoms get worse, the final column is when severe asthma flare-up is happening. There's increased difficulty breathing, instantly call your doctor, it says, and any other danger signs, you want to be calling an ambulance. So this is all here. It's great for someone who doesn't know about asthma. So if someone comes along, a family member or a friend, and someone does have an asthma action plan, they'll know what to do in those situations. So it's very helpful in that. But the second management of asthma is the inhaler, and that is what is most commonly carried with each asthmatic. So the second self-management strategy I was talking about is the inhaler. So inhalers are very commonly used amongst asthmatics worldwide. They're easy to use, easy to transport and make a perfect bronchodilator. So there's many different types of inhalers or puffers, the most common being Ventolin. So this is a quick reliever, meaning it will not last long, but it quickly subdues the asthma and helps open up the airways. So most commonly it's taken just as is, like as seen here. The dark blue cap comes off and the medication is puffed straight into the mouth and breathed in by the asthma sufferer. This is the most common way of using it, but today I'd like to promote the use of a spacer, which I will talk to you about now. What needs to change? So there's a lot of misuse of inhalers. So the misuse of inhalers is common amongst a lot of asthmatics. So this can lead to improper self-management of their own asthma and also unnecessary hospitalization of the asthmatics. So I believe using a spacer should become normalized, and not just for more serious asthma circumstances. So when someone's having more of an asthma attack or about to have an asthma attack, that's when people are most likely to use a spacer. So using a spacer in general everyday life is promoting great self-management of asthma and can definitely help prevent the asthma from furthering into attack. So how to use a spacer. A spacer is very easy to use, and I've just put a picture of a quick, simple instruction on how it is used just on the right here. So after step 1 and 2, most people are commonly putting the inhaler straight in their mouth and puffing the medication in. But where it changes is we place the inhaler into the end of the spacer and then puffing it into the spacer and then breathing in. So most people commonly use the inhaler straight into the mouth, but the spacer attaches and allows the medication to distribute more evenly to the lungs. So this prevents the medication from actually getting trapped in the mouth. So a lot more of the medication will spread. This allows us to relieve the asthma symptoms a lot easier and use a lot less medication. So I'm promoting a spacer for everyday use, not just when an asthma attack is about to occur. Like a lot of times, unless a child or adult asthmatic is about to go into an asthma attack or having very, very severe asthma symptoms, they won't use a spacer. So what difference does a spacer make? So using a spacer actually allows the medication to be properly inhaled. Using a puffer alone straight into the mouth reaches only 10% of the lungs, whereas with a spacer and a puffer, 40% of the lungs are reached. In times of an emergency, this could have an extremely positive effect and aid in avoiding an asthma attack. So in a case where someone's about to brink onto an asthma attack and they can only just use the puffer into their mouth, it's going to help, but it's not going to help to the extent that a spacer would. So just showing here on the right with this image, a lot of the medication gets trapped in the mouth and the throat instead of going into the lungs when just taken straight into the mouth. But with the inhaler, it's inhaled a lot better and spread a lot more into the lungs, which is exactly where you need it to be, especially when an attack is occurring. So I'm saying today that I think spacers should be commonplace. I think they should be used every day, in every single time a puffer is used. It should be commonplace procedure, not just in hospitals or doctors' surgery, but in everyday asthmatics' lives. Using a spacer has only positive impacts. It distributes medication more thoroughly to the lungs. It's quick and easy as using a reliever straight to the mouth. It's easy to carry, easy to transport, it's only small. And because it provides more medication coverage when you're using a spacer, you're more likely to be using less medication. So using less medication is not only beneficial to the body and the asthma sufferer, but it also saves money, it saves resources. So in terms of hospitals, pharmacies, personal use, this can save a lot of time, effort and money. So spacers should definitely be more commonplace. I would be providing a lot more patient education on them when patients come into hospitals or doctors' offices. I would be saying spacers are commonplace, spacers should be used every time an inhaler needs to be used. In places like pharmacies, I would be having a lot of patient resources, a lot of flyers, a lot of brochures promoting spacer use with not only children but adults, and there would need to be some form of information on how a spacer is used correctly. Although it's simple, it's a lot better for a patient to clearly understand how a spacer is used and how it affects the lungs a lot more, and actually provides a better result. In terms of using spacers on wards, a lot of the time it should already be commonplace. I know they do it a lot more with children, but definitely promoting this amongst adults, so when they learn good habits on the ward, they should be able to take this home and use it in their daily life and their daily asthmatic habits. So definitely using a spacer per person, letting each person take home a spacer if your ward allows it, and making sure you have appropriate stock, and making sure you give one-on-one patient information for each patient, making sure they know how to appropriately use the spacer, especially if they're elderly, making them understand. and they will hopefully have a lot more better asthmatic experience after this and provide a lot more relief than a puffer straight to the mouth. Thank you.